there are different type of stations, but as actually 60% station, I would say, is like this. Your job is to take history, examine, and then discuss the management with the patient. So I was talking about how to start a station yesterday. So I told you that the first impression is the best impression, and you start with the grips. Now, then, if the question says that you take history, then you'll of course you have to take history, which most of you know. But I will talk about how to take history later. But let me tell you what happens after that. After taking history, what you have to do? Examine the patient. Okay, you need to examine the patient. So the question itself says you do the relevant examination. Okay, now some of the questions is when they take relevant examination. I told you either there's a simulator or a mannequin. It can either be simulator or a mannequin. But sometimes you really have to examine. You really examine the patient. Really examine. Sometimes you don't have to examine. You just verbally mention about it. You just verbally mention that I need to examine your chest. If you say that, examiner will give the findings straight away. He will not. He is not expecting you to examine. You just have to say that I need to examine your chest. Examiner say, okay, doctor, on examination you found there's a reduced air entry on this side or there's a crack on this side. He will give the findings straight away. Okay, so when you verbally mention, two things can happen. Either examiner will give the finding. Please write down all these things. Either the examiner will give the findings, or the patient should patient shows a picture. Doctor, this is how it looks like. Either the examiner give the findings straight away. You don't really have to examine, or the patient will show you pictures saying that this is how it looks like. There are at least 5-6 stations where the patient shows pictures. Okay, so when you go through each station, then you will know. So there's a station where they show pictures. One example I told you, there's a young lady, she got a swelling. So on the shoulder, there's some other station where there's this man has got a swelling in the head. They show the picture, and then another lady, she's got a pain in the eye. When you tell her I need to examine your eye, she shows the picture of an eye, which is got a red eye, very red color eye. She shows the picture. Okay, or there's another patient who had a hernia operation, now is going to discharge from the wound. When you tell him that you need to examine that hernia operation site, when you tell him that you show the picture, which has got all the infected wound, operated wound. So they will show the picture, anything can happen, okay? Or sometimes when you verbally mention, nothing happens. Nothing happens. Nothing happens means neither the examiner gives any finding, nor the patient will show any picture. What do you do then? Then that means you really have to examine. Okay, that means you really have to examine. Okay, so if nothing happens, start examining. But some of the stations which you already came in exam, so far we have about 142 stations totally. Okay, some of the stations you just verbally mention, but the examiner, they don't want you to really examine. They don't say anything, but they just, doctor, move on. Means you don't really have to examine. Okay, neither the patient will show any picture, now the examiner gives any finding, and you don't have to examine it at all. You just have to move on. Okay, so summer station, which we already know, which came in the exam, you just continue. Okay, just continue without examining. Those stations we will be telling you in the class. Okay, this is a station which came where you don't really questions is examining. You do, but don't have to really have to examine. There's nothing there to examine. Neither the examiner gives any findings or another patient shows in picture. You just have to move on. Okay, so so that means for examination, any of these can happen. Means you start talking about it, I need to examine. When you say that, if the examiner doesn't say anything, patient does not show any picture, what do you do? Start examining. But there are some stations which I told you where you don't have to do anything, which you will know when you do the class. In that case, you just continue. Or when you verbally start mentioning, I need to examine, either examine give the finding or the patient shows the picture. That's it. You don't have to really examine. Okay, so that's what will happen for examination. Now, sometimes the question says you take history and discuss the management with the patient. So what is not that? No examination. That means your job is just to take history and examine, discuss the management of the patient. But when people did not examine, but examiner marked it as in the column examination, the feedback. They marked it for examination and they scored less. What does that mean? They are expecting you to examine. Okay, so that means what I'm trying to tell you is whether the examination is written there or not. What are you going to do? Start mentioning about the examination. And when you mention examination, most of the time it happened that the examiner gave the finding. It's not mentioned in the question examination at all, but examiner gave the finding. So now that means whether the examination is written in the question or not, that is irrelevant. Do you understand? You always assume you have to examine, otherwise you'll miss it. It happened to many stations where we did not even expect that the examiner is expecting the examination in that. But the examiner marked it as problem in the examination. And people who did examine, who started mentioning, examiner gave the finding on that day for those stations. All of you understood what I'm saying? These are very, very, very important things what I'm trying to tell you. Okay, so don't miss anything. Even if the examination is not written, you start verbally mention. The most of the time examiner will give the finding. Or if no finding, he will at least say, doctor, examination, everything is normal. At least he will say that. Okay, so that is about the examination. Then about the management. So once you history and examination, then you have to talk about the management. What is management? Management is not just treatment. It is investigations and treatment. That is the investigations and then the treatment. Then the treatment. But after history, then you have to do the examination. Okay, examination. But before the investigation, what is there in your mind? What? Sorry? Diagnosis. What diagnosis? Provisional diagnosis. Unless you have a provisional diagnosis, can you decide what investigation you want to do? No. So that means what comes before the investigation? Provisional diagnosis. Okay, you should have a provisional diagnosis. Because without having a provisional diagnosis, you don't even know what investigation you're going to do. So you have provisional diagnosis in your mind. Will you tell that to the patient? Provisional diagnosis? Yes. Most of the time you do tell. Maybe sometimes only you don't tell the provisional diagnosis. But I would say 90% of the time in the exam, you will be telling the patient your provisional diagnosis. Okay, so then comes the investigations. You do the relevant investigation. What comes after the investigations? Before the treatment?
Discussing what's the diagnosis.
What diagnosis? Definitive diagnosis. Okay. So now the confirmed diagnosis is confirmed once you have investigation. Then comes your definitive diagnosis. And then comes a treatment. Okay, definitive diagnosis. So that means this is the structure you need to follow in almost every station. Okay, you have to take history, the examination, then you talk about the provisional diagnosis, then you tell the patient what investigations you want to do, then they talk about the definitive diagnosis, then you talk about the treatment. So now, examination already told you what happens. Then you have to talk about the provisional diagnosis. Now, what I'm going to do is I'm going to give you a scenario. I want one of you to talk to me about the provisional diagnosis. Imagine I'm the patient, I'm Mr. Smith, I'm a 35-year-old man. I'm having fever for the last 5 days. And I'm having cough and a yellowish sputum for the last 5 days. And I got a right-sided pleurotic type of chest pain for the last 3 days. And I'm feeling a bit short of breath. All of you got a provisional diagnosis in your mind? Yes? Okay. Now, I want one of you to tell me what that is with the history. History. Imagine you got that. And you ruled out all of the things, whatever else in the history. Then examination, you tell the patient, I need to examine your chest. Examiner says, doctor, there's he's got a temperature, high temperature. Any examination starts with what? Vital signs. Okay, any examination starts always with vital signs. Okay, so either this chart there, vital signs chart, which I told you is the new chart, or the examiner may say, doctor, here, this is this. Okay, imagine the examiner told you, doctor, he's got a high temperature and he's got crackles on the right side of the chest. Yeah, so imagine you got that examination finding now. Now, I want one of you to talk to me. I'm the patient. Who wants to talk to me? Who wants to talk to me? Come on. Yes, talk to me. Yeah, I'm Mr. Smith. You know the symptoms? You know the examination findings. Okay? Talk to me. What else you want to tell me after that?
Mr. Smith, as we did our examination, the yeah, I can't do
You're very happy for me.
it.
Do I have a good news?
No, I don't think I need a few more days.
You need for a few more days. Have you seen patients before?
Yeah, I've seen it, but
Have you spoken to patients before?
not in English.
Not in English. Okay, talk. What is the language? Turkish language, yeah?
Yes, okay.
Okay. Talk to me in Turkish then. Okay, who wants to talk to me? Yeah.
Okay, Mr. Smith, from my interaction with you and from the things I found out on examining you, there's a very strong likelihood that you have a condition that is called pneumonia. Have you heard about that before?
No.
Okay, so would you like to know what it means?
Yes.
Okay, so pneumonia actually is an infection of the chest. What happens? Pneumonia is what they call an infection of the chest. Are you following me?
No.
What happens is there are some germs or bugs that get into someone's lungs and they cause the condition that you have. So what happens? Are you following me?
You mean to say there are bugs in my lungs?
Yes, that's what I mean to say.
Oh, yes, I'm following you.
Okay, so that's what we think very strongly that is the cause of these complaints that you presented. Is that clear?
Yeah.
Okay, so we would need to do some tests to confirm this diagnosis that we are thinking of. Would that be okay with you?
Yes.
Okay, so some of the tests that we need to do include a chest X-ray, and it's like have you heard about that before?
Of what?
An X-ray, it's like a photo.
Yes,
of
I know.
the chest,
I know, yes.
to know what's happening inside the chest.
Okay.
And you take some of the phlegm that you produce to look out for the bugs in the phlegm, so that we would have an idea of what bug exactly is causing it. Are you following me?
Yes.
Okay, so when we get to know the bug that's causing it, the lab will also help us know what medication would be useful to treat that condition. Is that okay?
Yes.
So would you like us to go ahead with the tests?
Yes.
Okay, that would be nice. And then we would go on to give you some medications.
Doctor,
Yes, please.
anything else you wanted to?
Okay.
You know, my friend also had this problem.
Beg your pardon?
My friend also had a similar problem. He went to the hospital. They took some blood out of him. I also got a lot of blood if you want.
Okay, thanks for bringing up that issue. We would also like to do some blood tests for you. One of the blood tests is to have an idea. As we call that test a complete full blood count. And would you like to know what it means?
No.
Okay, so well, okay.
Why are you doing the test?
We'll be doing the test so that we could it would be a pointer to the presence of those germs in your body or
The full
bugs.
blood count
Yes, and
tells you the germs in the body.
now it will tell us about the reaction of your response of your body to those germs. So by looking at the response within your blood, we'll have an idea of what type of bugs are causing this this condition you're having.
Okay.
And so then when we would start you on some of those drugs right away,
Drugs?
or some of those medications right away.
Okay.
And the medications will start you on. But before I mention the medications will start you on, please like to confirm one or two things from you.
Yeah.
Are you allergic to any medication?
Not that I know.
Not that you know of. Okay, so we'll start you on some penicillins. And when we get the results of the test that we do with your sputum, or phlegm, would cross check to know whether the drugs you are